Welcome everybody to the PendulumLost podcast in collaboration with LDN Physio. I'm here joined by Mitch and Sarah, running co-leads at LDN Physio. Thank you for joining me once again. But instead of you guys joining me, I'm actually going to be joining you because there's a few things we're going to talk about with running. Being superstar runners yourself and being really amazing physios. Stress fractures is something probably you hear and see about. And I kind of want to know, it feels like, is there more of them going around? Is there stress fractures on the rise? What's going on with stress fractures in the running world, do you think?
Yeah, I mean, stress fractures at the moment are definitely a hot topic. Pretty open discussions been had, all over Instagram, all over the internet now, which is actually great for us. I mean, it increases people's awareness, and I think in that respect, people are sort of catching on to them a little bit sooner. So maybe more people are coming in to be assessed to see whether they might have a bone stress injury because they've seen, this influencer, that influencer also, go through the same thing. So I think in that respect, yes, we're maybe seeing more come into the clinic, but it's not to say that there's necessarily more stress fractures out there. I think the first thing that we kind of want to get across is that stress fractures are not a new thing. Stress fractures have been around since humans have been around, I assume, and definitely since running's been around. But obviously it's marathon season right now. There are more people running. It's obviously a very, very busy time in terms of running volume, so we're naturally just seeing more stress fractures at this time of the year versus in Christmas time, for example.
Yeah, it's kind of like peak season now and people are really starting to ramp things up. But I'm going to say something. I had not heard of stress fractures until I started working. We didn't really learn about them at uni, and you learn about all of the joint stuff and soft tissue stuff, but I suppose it's quite specific to a sport like running where there's repetitive load on your bones. And yeah, I've been referring lots of people recently to see affiliate consultants of ours to have MRI scans to check. Perhaps at times I'm overcautious, but I have been in positions where I've missed them, and I don't want to do wrong by somebody, so I'm trying to just be really vigilant at the moment to make sure people get the right care.
To be fair, I think that's wise. I think you can't really afford to miss stress fractures just because the risks associated if you do miss them are quite high.
Yeah.
So I think in this instance it's always better to be safe than sorry. I think when you're suspicious of potential bone stress injury, you're much better off knowing, you go and get an MRI and it comes back all clear. Phew, thank goodness, right? You'd rather know. It's definitely worth sort of ticking it off because again, this is probably something we'll talk about in greater detail in a second, but it helps dictate how the rest of your marathon block's going to go. It'll dictate whether you can run the marathon at all, right? Like we know that if you're dealing with, like I said before, like a joint-related injury or a tendon or a muscular injury, you can push through a certain degree of pain, right? If it's a bone stress injury, that's an absolute no-go, right? Any sort of symptoms, no running whatsoever. You have to be pain-free. So clearing a stress fracture versus something else is pivotal early on to dictate whether you can keep running or not. So yeah. I think you're right to be overly cautious, I think.
Yeah.
People always ask me, they say, oh, I haven't got a fracture, or I haven't broken my bone, I've got a fracture. Or, we always get asked that question. And then obviously now stress fractures. What is the difference and what is actually a stress fracture?
So a bone stress injury, if we put it into a category, you can have different grades of how the bone responds to overload. So you can have very mild, just a little bit of maybe what you call swelling around the bone. A bit more severe then would be swelling inside the bone. Then you have the bone marrow, which you can get changes within that. And then you have kind of end stage where there's an actual fracture on the bone. And we talk about different risk areas. So for a runner, like 90% of the time you're talking about from the waist down. There's some areas that are much higher risk than others, and something that might be of higher risk would be because of the blood supply to it, or the chance of it not healing properly, or the bone being in an area where there's quite a large bone, and so we talk about low risk and high risk and how we want to differentiate, and maybe the treatment would be slightly different for somebody who's got a low risk versus a high risk.
In terms of the bone response, when we are involved in high load sports, Without getting too technical, we have this thing called Wolff's Law. I'm not going to get into it, but essentially your bones are a dynamic structure. So there's constant breaking down and remodeling of new bone tissue, sort of like Sarah described before. So what we see is that your bones are constantly getting stronger in response to the load that we put upon them. But if you do too much, the rate in which that bone tissue breaks down occurs way faster than it's able to remodel. So basically you've got breaking down quicker than new bones occurring, and this is where these stress responses can occur. So, and as Sarah said, we've got those sort of classifications, those categorizations where we've got a grade 1 all the way through to a grade 4 A and B. And there's typically, that sort of like low-level reactive response where it starts, and then it can progress if you don't take the necessary steps or you keep pushing too much. It can then progress into a fracture.
Yeah, being a fly on the wall, listening to some of your conversations recently is about things that have influenced the increase of kind of stress fractures out there. What kind of things? What's the biggest things out there that you think are kind of detrimental to people's bones?
So hopefully lots of people know by now what RED-S is. So relative energy deficiency in sport. This is essentially people overtraining, underfueling. So me, for example, when I did my first half marathon, didn't think at all about the fact that I need to be eating more for the additional 600 calories that I just burnt from the run that I just did. And you do start dropping in weight when this happens. You may have like a nutrient deficiency at some point along the way, especially being female, and that has a systemic effect on your body. And these things are all reasons that you may end up in a situation where you are energy deficient, and therefore your body doesn't have the nutrients and energy to keep your tissues healthy. So you could be at risk if you're not eating properly, essentially.
Yeah, on the topic of RED-S or REDS, there's a few sort of hallmark symptoms that we often ask or screen for when someone comes in. So a really key one, obviously, is if someone's engaged in high volume running or high volume sport, automatically, there may be a risk factor associated with that. And underfueling is always a key one. So asking about a history of disordered eating, getting a general idea of how well someone's fueling. Unexplained fatigue and exhaustion. If someone's getting a really, really good quality sleep but then waking up just knackered every day, that's definitely something to look out for. In women, this is a little bit more obvious. In males, it's a bit more subtle, but looking for signs of hormonal irregularities, so gastrointestinal upset, menstrual cycle irregularities, sort of like delayed or absent periods, or when there's just a big change. But these are all some sort of classic symptoms that someone might be presenting with REDS or RED-S.
I guess you want to pick up on that quite early, right? And how is it how hard is it to then not go completely down that? When someone's coming, it might be an innocuous injury, and you think, damn, I want to go actually. There's a few of these symptoms, and does it get you worried sometimes straight away? Are you thinking, like a bit of a panic, or you want to kind of go down that route?
I think naturally I would always be hyper cautious of things. You don't necessarily need to be, but if things are building a picture in your head, if somebody, for example, is female, hasn't had a period since they were 17 and they're 25 now, if they don't have a job where they can't eat properly or they eat at weird times, if they had like an iron deficiency in the past, things like that. Anything systemic, and it's just building a picture for you in your head that the chance of this person having a bone stress-related injury increases with the more of those symptoms that you take off.
600 calories you mentioned earlier about per day you have to eat more of, right?
Depends on the length of the run, but it's very difficult to be in a calorie surplus when you're training for the likes of a marathon. So
in a calorie surplus or a calorie deficit?
Calorie surplus.
It's hard to be in a calorie surplus.
Yes. Hard to be in a calorie. Yeah, surplus.
Yeah.
Why?
Because you're burning so much energy. You have your daily.
So people
major-
are mostly in a deficit.
But then like with high volume training, you'd expect to be hungry a lot more often.
So do you think people are harder to be in a...
It's not necessarily, it's just way riskier for people who are trying to be in a calorie deficit whilst training for a marathon. Because a lot of people are, unfortunately. That's the things that I'll see and hear quite often. There's this really unfortunate paradigm that's out there that's, if you're lighter, you're going to be a faster runner, or you're going to be a more efficient runner if you're lighter. So that encourages this disordered eating culture within the space of running, which is really unfortunate, because I think a lot of people, particularly those who are maybe slightly not necessarily larger runners, but just heavier runners, even like really muscular runners, for example, they feel like they cannot be a particularly good runner if they weigh their current amount. So what they're going to do is they're going to go and run 70, 80 Ks a week, and they're also going to put themselves in a calorie deficit. We know that then the body cannot recover properly. This increases chance of stress responses and stress reactions and these sort of things. It's a stress fracture risk.
I think that's for two separate things then, isn't it? Because I thought the same as you,
Yeah.
that actually, you eat a certain amount and then you ramp things up, and actually the frequency and the volume, the amount you actually eat, just because you're hungry, but maybe it's not used to eating and this habit.
I definitely get what you were saying. I misinterpreted what you'd said.
I thought I said it wrong.
Yeah, I know it was probably me. It was just a misunderstanding.
But I mean, I think you're right. There probably is two different categories.
I think Sarah's right, and that it's really hard to be in a calorie surplus when you're eating as much as you can but burning so many calories, right? So it's like you might be trying to eat a whole lot, but you're still only sitting at your maintenance calories. I think that's maybe what Sarah was trying to get across.
I worked with a guy who was like bodybuilder aspiration, competing and stuff, and I remember him just having to like force himself to eat rice and tuna. He was like, he had a bit of ketchup, and he's just
Forcing it down.
Literally was just trying to eat, and I was like, what are you doing? He goes, I need to hit my macros, So I kind of feel that picture sometimes. I can imagine, trying to get those extra calories in.
But also if you think about, so say for example, I'm training for a marathon, I'm in peak, the height of the block, and I have my pre-run fuel in the morning, which might be like toast, peanut butter or something. You bring like a gel with you, and then the run takes you maybe, let's say, between 2 and 3 hours. By the time you've done all that and you come home and you shower and then you have whatever meal it is you have, and then you have your dinner, that's like, you kind of need another meal in there as well. And lots of people, I think, don't realize actually how much you need to eat in order to be in maintenance once you're training that hard.
Totally. And that's let alone when you're healthy training for a marathon,
Yeah.
right? If you've currently got an injury, you need way more
Yeah.
calories in to try and actually help that recovery process and help your body heal. Like, again, it's an energy in versus energy out equation. The more you're eating, the faster you're going to recover, generally, right? So it's like, if we are currently presented with a bone stress injury, and this is something a lot of people don't factor in. Let's say, for example, you've got a stress fracture, and we've said, right, okay, unfortunately for you, Manny, there's no running for 6 to 8 weeks. And then in your head you go, right, okay, I'm not running for 6 to 8 weeks. That means I can't eat as much because I'm not going to burn it off. So I just have to eat less because I'm going to get, I'm going to get overweight if I do that, right? That's a really, really negative thought process, a really negative belief to have, because we actually know that even though you're not running, to fuel yourself appropriately so that bone tissue can heal, you should be eating way more. Unfortunately, we see this mindset of, I have to earn those carbohydrates, or I have to earn those calories. And obviously, not a dietitian, none of us are dietitians here, so it might be a little bit without this, outside of the scope, but we know that when you're currently dealing with an injury, particularly bone stress injury where it is metabolic in nature, you need to be eating so much more than you realise.
I always ask people as well when they come in for any type of initial assessment, when when a patient first comes to see us, what is your diet like, what is your sleep like, and how are your stress levels? Because I think they're really good indicators of how somebody looks after themselves. Is sleep important to them? Are they recovering properly? Are they getting 7 to 8 hours a night? Because you're not going to get better from any injury if you're not sleeping properly.
Totally. You can be doing all the right things from an exercise perspective, but yeah, you're right. If you're not nailing that stuff, no chance.
Yeah.
When you were saying about the reverse, people eating less, there's people who are running, for example, fitness to lose weight, and then there's the regular runners. Do you think that what you were saying applies to both, really? So, it's not just those trying to lose weight, it's actually those that don't need to lose weight, but they're actually under-fueling because of that.
I think it maybe comes down to training volume and training load rather than the reason that you're training, I guess. I think maybe you need to put that aside, and it's more about if you're running a considerable amount, you need to be eating a considerable amount.
Regardless,
right? Naturally, what's going to happen because the amount of calories that you're burning, they're naturally going to be so high if you're doing high volume running. Even if you're eating maintenance levels of calories, or even just above, you could still be in a slight surplus, and you'll naturally drop weight nice and slowly anyway. It's just going to be a much more gradual process. It's a much safer option than just going, right, I'm going to cut all the food out because I'm trying to lose weight, and then go and run every single day of the week, right? It's like I understand that it's hard for a lot of people to sort of to do that, I suppose, but also just from like an energy levels perspective, if you're in a calorie deficit, so you're not eating enough, you're not getting enough food in, and then you're running so much, you're just going to be exhausted all the time because you're not fueling yourself appropriately. That's also going to lead to the higher injury risk and that sort of thing.
Have you been able to manage your calories well when you've been training for a marathon?
I will be the first to admit, no, I've been pretty poor.
Classic physio.
Yeah, I've been pretty poor in the past, and I'm a good case study for this topic as well. I mean, I had a pretty nasty stress fracture in my shin a couple of years back. It's a classic case of you learn so much throughout that process, and now I know that I'm managing stress fractures so much better than I managed my own. It was just like, I hadn't had that learned experience. Yeah, I mean, look, I've gotten way better, fueling for long runs and eating appropriately before runs in general, but general caloric intake has always been quite low, I think. So, touch wood, if I was to have another stress fracture, I'd probably get that right. I'd probably do a better job. But no, historically, I've been pretty bad.
I mean, there was apps, isn't it, to track your food and stuff. Do you think people use them a lot for like food tracking apps and stuff?
I think you get into a bit of rocky ground once you start counting.
Yeah.
It depends on the person, but anybody can fall into that obsessive pattern. But yeah, how much is enough? Like, do you do it based on how you feel? Like, I'm hungry, I'm going to eat, or do you just make sure that like all of your meals are healthy fats, carbs, and protein? I think that's what I do. I definitely make sure that I have 3 meals a day, have a couple of snacks throughout the day, and then it's very balanced, and you eat until you're satisfied. And if you exercise more that day, you eat more that day.
Yeah, I think at this point it's definitely worth saying, like, if there's any concern, speaking to a dietitian is definitely the best thing to do, right?
Yeah.
Especially when you are involved in endurance sports in particular, but all sports really. I think having some sort of liaison dietetically, I think is super, super, super important.
From a physiotherapeutic perspective, with regards to bone stress injuries, what do you think people would like to know about maybe how to maybe recognize things and what they should do if they are concerned about a niggle?
I think the most important thing you can probably do is, retrospectively, go and have a look at your previous training weeks. I think that's always a really sensible one. Like, if you've noticed that there's been a massive spike in your training volume, we're going to use running as an example, hence, we're obviously running specialists, but, you did, 10, 15 kilometers total weekly volume, for the whole month of, November, and then all of a sudden in December, you're like, right, I've got a marathon coming up, let's go and do 40K for the week. So you have this massive spike. That's already a risk factor. So I think if you're already suspicious that you might have some symptoms aligning with bone stress, have a look at your previous training weeks. If your training volume has increased very, very incrementally and very sensibly, your risk's going to be a lot lower. That doesn't mean that you won't have a bone stress injury, but that's the first thing I often do. I mean, symptomatically, early onset bone stress reactions, they often present, shin splints is a really classic. That is a bone stress injury in a nutshell. A lot of people don't realise that shin splints is a bone stress injury. So that sort of low grade before it progresses into a stress fracture. But from a symptom perspective, we often know that early on, like a generalised diffuse achiness is quite classic. We'll get worse with activity and we'll typically settle down with rest. If you do too much, you might not, you might find that there's a bit of a lingering achiness, a bit of a lingering pain, but then typically you wake up in the morning and might feel totally fine at an early bone stress perspective. As time goes on, if you keep pushing the training volume and nothing changes, as we progress through those, those categories of bone stress injury, you might notice that diffuse ache you had over a broad area becomes a little bit more focal. It's over a smaller area. It's easier to localise where that pain's coming from. And not always, this is not always the case, but often a really clear distinction for us is when something begins to present more like a bone stress injury, is when sharp pains become a feature rather than just feeling generally quite achy. I think at any point, if you've got fine pinpoint bony tenderness and you're getting sharp pains when you're hopping, when you're changing direction, when you're running, that to me is a flag. We want to get looked at for sure.
Also, a nice way, not always, but a nice way to distinguish if something might be tendon related as opposed to bone related is if you kind of warm up to it. So you start the activity, so if you start the run and you're like, ooh, this is a bit painful, and then maybe 2K in, it goes away, and then you're okay. And you're sitting down having coffee with your friends afterwards, and then you get up, and then you feel it again. That's more likely a presentation of a tendon, whereas bone would be more pain on impact, lingers afterwards. You might get pain later on that day or in the night time, and like Mitch said, diffuse pain might become a bit more focal, and it's actually tender to touch as well, especially if it's lower down in your leg.
Totally.
And a really good way that you can just check something at home is to just hop on it, and if that causes pain, you may need to come and see us.
That might be a good litmus test even, to determine whether is it a good idea to go for a run today even. It's like if you've got, again, I'm going to use the shin as an example because that's the most common bone stress injury we'll see is a posterior medial tibia or inside of your shin. If you're thinking about going for a run and you can't do 10 to 15 single leg hops without pain, you shouldn't go for a run. I think that it's a really easy test you can do before determining whether you do go for that session or not. But yeah, I really like the point you said about the warm-up effect and distinguishing sort of like a tendon or a muscular pain rather than bone stress. And you're right, bone stress injuries will typically they'll be present once you start the activity, and they will often get worse. Yeah. Just the opposite of, like you said, a tendon, which will typically warm up and feel better. So I think that's a key one.
I think you mentioned about shin splints. Just for those out there, that is there like a happy, safe shin splints compared to those that are progressing to something worse? And how do you know if actually, let's not panic, I've got a bit of shin splints? Is there a certain way for them to realise that?
Yeah, again, it's a good question. And this is where when we're dealing with like medial tibial stress or shin splints, it is always worth looking at it a little bit closer. We want to determine whether this is, again, a little bit of overload around the shin. Obviously, it's a complex area. There's lots of, there's lots of muscles, lots of tendons through there, obviously the bone structure itself. Again, I think we like to use that sort of like generalized like achiness. Again, it's a little bit tender to touch, but I wouldn't consider it to be like, excruciating or particularly uncomfortable. You'd be like, oh yeah, that feels a bit tender to touch, but like I can hop, it feels fine. Yeah. When I run, it's a tolerable level of discomfort. I think that's always a really key thing. Again, the moment you start feeling sharp pains, that's a sign for me that you probably need to pull things back a little bit. But if we're looking at like shin splints is maybe like an umbrella term, I think is probably a fair representation, and that yes, you have that classic, medial tibial stress, which is obviously in the bone tissue on the inside of your shin here. We could have, like Sarah alluded to before, like an overload of some of the muscles at the front of your shin. They kind of sit within that shin splints cluster. It's complicated, but it's a really, really important thing for us to do is to actually assess your shin and try and differentiate between what could be a structural cause. Because again, if we're dealing with a bone stress reaction, which could present quite similarly to just generalized muscular pain, if it is a bone stress injury, we're not allowed to run on that, right? If it's something else, if your pain's less than a sort of a 3 or a 4 out of 10, you're generally fine to proceed. We'll call that like a green light zone. You're safe to be participating in impact loading. If it's bone stress, we need to stress the importance of it being 0 out of 10 is your cutoff. Any more than that, any symptoms, cut it. Sarah, I don't know about you, but in the clinic lately, I've seen it. Obviously, being marathon season, lots more runners coming into the clinic at the moment, and a lot of them are using, AI training apps and those sort of things. Maybe it's just my Instagram algorithm, but I've seen a lot of hate towards those apps at the moment. A lot of negativity, and again, maybe because of the incidence of stress fractures as of late. Do you have an opinion on the AI training apps? I'm not going to name any names, but we know some of the big players in the game.
So I have never used any of the apps myself. I haven't done a marathon. I have no desire to do a marathon. I'm a half marathon gal. But from what my friends who use them and from what my patients say, they, in some ways, they do seem quite binary in that they'll give you, your easy run, your interval training, and your long run on any given week. Unfortunately, what we see is they don't always take into account like how you're feeling on a particular day, or if you are on holidays and you have to skip a week, like what should you do then? I know a new function on them is that you can ask a bot, or you can ask a coach or someone for advice. But I think if people go into these and follow them like exactly, you may end up, with a bit of a disaster because you haven't listened to your body. I think take them as with a pinch of salt, in that like that's your rough plan. But if you've missed out on Thursday's interval session, don't do it on Friday, and then don't do your long run because you're told to do 34k on Saturday. You have to have a bit of leeway with it.
I think that's a really, really good point. I think that kind of highlights it's my perspective that the running apps themselves are not the problem. I think they certainly have their place. I think particularly for novice runners, they give you structure. If you're not used to a structured training plan, it is quite an intimidating space, right? So having it laid out, for you, it's really nice and colourful on the app. It looks well presented. You can sync it up with your watch. It's really, really nice. But the issue with it is the not looking internally and having, putting your critical thinking cap on and be like, what, I actually feel rubbish today, right? But this AI app is telling me that I need to run a 17k tempo session. I don't feel great, but it's telling me that I need to do it, so I need to go do it. That's the problem. I think having the apps themselves that are setting out a training plan for you is fantastic, but I think as the athletes or as the runners, we need to be better at assessing our own situations, listening to our bodies. And as Sarah said, these training apps, they are no substitute for a real human being or for a real coach. Your phone in your pocket doesn't actually know you, doesn't know how you're feeling, doesn't know how stressed you've been at work, doesn't know your situation, doesn't really know how tired you are, and it doesn't factor that stuff in. So I think, like Sarah said, it's really nice to have that as a generalised plan to follow to give you some structure, but it shouldn't be gospel. If you don't follow it to an absolute T because you're feeling rubbish on the day, that's totally fine. And if anything, that's what you should do.
Do you think that has led to a lot of the stress fractures that we see, think? It's a complex question.
It's a complex question, and again, I think maybe there's a contributing factor. I'm not going to say that there's not, right? But again, what we said before, like, there are more runners out there because there's been a running boom. The London Marathon in particular is like the most ballot entries out of any race on the planet. There's like 2 million people who try to get into the ballot now, right? So it's like there are so many runners out there. More runners, more stress fractures, more runners, more people using the apps, right? So it's like, yes, we may be seeing more stress fractures at the moment, and we're seeing more people using the apps, but this could very well be a correlation versus causation argument, prevalence versus incidence argument, I think is really key as well. I'm not going to sit here and say no, there's no contributing factor there for sure, but I think again it comes down to potentially people just not looking inwards and listening to their bodies and just blindly following what an app tells them to do. Again, it's not the app's fault, it's all of yours. No, we just need to think a little bit more critically and just assess how you're feeling a little bit better, I think.
I think the prevalence of all of this in the media at the moment about like stress fractures and stuff, I hope that it's raising awareness about what you should and shouldn't do with regards to your training. Maybe it's scaring some people, but it's ultimately, I hope that it's educating people to know their bodies and to know what not to do. And just because an influencer of yours is doing X, Y, and Z doesn't mean that you have to go and do that as well.
Yeah, totally. I think a key, just to jump in really quickly as well, a lot of the influencers we see, particularly the big ones, like, it's often their full-time job is to be on Instagram.
It's like being an athlete, like a professional athlete.
100%. So it's like they have the time to run outrageous volumes because they're and credit to them, they're in a position where that's they've managed to make a living by doing that sort of thing. And I think it's amazing. But you can't compare, like we can't compare our lives with theirs. We have full-time jobs. It's very, very different. So yeah, I get
Do they push the AI apps as well?
Some of them.
Yeah, but again, it's just like affiliations, and they get sponsored by the apps and they get paid by the apps to endorse their stuff. So yeah, totally. And I think that could also be where some of the problem may lie. But
they don't necessarily, they might not use it themselves.
That's the thing. Yeah. That's the thing. And like I personally know like a few influencers in the running space who will very, very heavily endorse these apps, but they have a coach and they don't use the apps. So it's like it's you get paid to endorse a product. You endorse the product sort of situation.
Take everything with a pinch of salt. Anything you see online, just things aren't always as they seem. So.
Social media is not real.
For the really kind of early stage runners, a couch to 5K, springs to mind. Does that jump into the category, or is it obviously it's not AI? Is that something that doesn't enter this topic of controversial apps, or does it?
I have never heard of someone getting injured while on a couch to 5K.
Okay.
It's very gradual, and it's literally for, like, you can be someone who has never run before in your life, and you could be perfectly fine and turn into a really good runner from it. I've never heard of it going wrong. I think it's so gradual.
Yeah, I agree. I think the Couch to 5K program's pretty good.
Yeah.
Pretty good. I think, as Sarah said, the gradual progressions I think are the key. Like, and again, I don't want to get. I've said I'm not going to bash the apps, and part of me I'm starting to bash the apps a little bit. They do have a tendency to increase intensity very quickly. So you'll have someone who's maybe at a couch to 5K level, but they'll jump on one of these apps, and then it'll get them doing, pace work that they can't sustain in week 2. Couch to 5K program doesn't seem to do that. And like Sarah, I don't think I've seen someone get an injury from a couch to 5K either.
It's very reliable.
Yeah, I think it's generally pretty good. We're not in the pocket of big couch to 5K. We're not getting paid by it. But,
we are not sponsored by Couch to 5K.
We're not sponsored by Couch to 5K.
It's free, isn't it?
It is free.
Yeah.
It's free, yeah. I think it's tricky when somebody says, I'm going to do a marathon, and they've never run before in their life. Not like great challenge, like go you. But I think you're opening the door to lots of problems if you're not educated enough as to what this is going to entail. I think we spoke before on one of the previous podcasts about are you ready for what is going to come at you for the next 20 weeks?
I think that's such a good point. It's funny, I think the amount of people running the marathon, in the last few years because of the boom, I almost think people have lost the respect for the marathon distance a little bit. Mm-hmm. It's a really, really long way, and it's so hard. And committing yourself to a full block, I think, is way harder than a lot of people realise, because they see so many people running them and they go, they can do it, so can I. And of course, anyone can do it, right? But I think people, like you've said, Sarah, I think people are perhaps jumping to the full marathon distance way too quickly. Like if you've never done, any sort of structured running before, no structured plans, you've not done half marathon, even, like, don't get me wrong, you can jump to a marathon, if you've done 5 and 10Ks, you've been running for a considerable amount of time. But if you've done no form of structured running training before, and you're maybe only at, a maximum of 5K distance, a marathon is pretty ambitious.
And I think as well, you definitely need to have at least 6 to 8 weeks of strength training behind you before even starting that marathon block.
I would agree. Yeah. That also contributes to stress fractures, like we spoke about before.
Yeah.
That's all we've been talking about. It's the topic of the podcast. But obviously, training errors are the single biggest predictor for whether you develop a stress fracture. Doing too much too soon. Put simply, doing too much too soon is the single biggest predictor. But strength training plays a massive role as well. Like, we know calf complex, glute complex, these are all really, really important. All the muscles that you have to generate and absorb forces when you run. Again, your calf, for example, every time you hit the ground, your calf has to generate 6 to 7 times your body weight every single time you hit the ground, right? So if you're running a marathon distance, the average steps on a marathon are 50,000, right? Divide that by 2 legs, 25,000 times 7 times your body weight per time you hit the ground. That's a lot of load, right? Your calves need to be pretty strong. If you cannot do calf raises consecutively, you definitely need to work on that before you start trying to run, you know, a 30k on the weekend for training, right?
Yeah.
It's the exception, not the rule, people, which gets to me is when they say, you know, I knew my mate who never ran before, is really unfit, and then he signed up, and then 3 months later he just ran ran the marathon in 3 hours, that thing. So, you know, you're right, it's like, oh, they could do it, but they're the exceptions. I'm guessing there are the odd people that can just do it, but the majority, it's not. And I think the pinnacle, marathon was the pinnacle now, and I think everyone talks about, oh, it's only a 5K, it's only a 10K.
Yeah.
I'm like, oh, yeah, that's, you know, that is still really hard for majority of people,
It's such
right?
a small percentage of the population of the world who has done a marathon, but we're just in the height of it.
Yeah.
Like, we're in London, we're in this industry and community. It feels like that's all there is.
And it's all you see on
It's
social
all you
media.
see, it's all I see. So you can get, I see how people get so wrapped up in the pressures of it and feeling like, no, I need to go for a run, or no, I need to get this time, and that pressure can also lead to injury as well, and you know, catastrophic injury if you don't understand your body, you know.
Because I'm approaching the Middle Ages, and they always say, you know, midlife crisis is I'm going to end up doing a
Convertible.
no,
Get a BMW convertible.
no, I think it's is it triathlon or an Ironman or something like that, you know?
Yeah.
So there's that kind of social pressures, right, of that. And to be fair, I did say I was going to run a marathon before I was 20, and then moved to 30. Now it's going to go to 40 because I don't know. I just feel like there's something in my head that someone's told me that I have to do it once in my life, but you don't, right?
You don't have to do it. You don't have to tick that off the bucket list. But
It's a great bucket list goal to have. Don't get me wrong.
It's a fantastic achievement.
Just build up slowly. I think that's the point.
Just relax, like.
And then probably to kind of close it up, what kind of things, I think you mentioned the things to look out for that you probably would want to get checked out for. Probably the biggest couple of things that you would say, definitely look towards seeing a physio if you're having certain signs and symptoms. Mainly going back to the stretch fracture, what are the kind of the key points you would probably say?
I would say if you're having a pain that is above a 4 out of 10, that's not going away. If you've had X amount of injuries the previous year, if you've any doubt over what is happening, or even if you just want a bit of advice, just come and see us and we can just root it out.
Perfect.
What would you say?
Yeah, fair. I mean, look, in the context of bone stress injuries, I mean, like, again, whenever we're dealing with sort of like pinpoint bony tenderness, again, that's a red flag for me. You need to get checked out. Sharp pains on impact. Swelling is always a key one. You go for a run, your shin gets quite sore, your foot gets quite sore, you notice some swelling. Again, like I said before, it's better to be safe than sorry. It's always good to get that sort of thing checked out. But again, just general rule of thumb, I think, like Sarah said, like using that traffic light system is quite good. Like, if you're engaging in any sport, or running in particular, and your pain is on the verge of, is this tolerable, is this actually pain? That's probably when it's worth coming to get looked at as well.
Yeah.
If there's any part of you that goes, oh, I'm starting to think this could be something, we generally, hopefully, we're all pretty in tune with our bodies. If you start to have any sort of doubt or you're feeling like something could be amiss, come see us.
Amazing. And then also, because you guys do running analysis yourself, but also can refer onto the Red S team within LD and Physio as well. So obviously, you're right, any doubt, at least there will be some positive to the right places.
Totally, yeah, 100%. And then, like, physios, you know, whether it's us or anyone else, I hope it's us, but yeah, if it's we all can refer to the necessary or appropriate channels as well, right? So, you know, if we determine that you could be, you know, at risk for a bone stress injury, this is where we make that referral for you. We make it really nice and simple so you don't have to stress too much. You come and see someone like us to begin with, kickstart the process, and we'll, you know, necessary referrals will be made.
We've got good connections.
Got the connections. Amazing. Thank you so much. It was very enlightening. I'll see you next time.
Thanks, Manny.
Thank you.